Once again, we are now going to apart posture in order to help our pelvic muscles. This is called Parshvakonasana, a side angle posture. Use the area of your mat, bring one of your legs backwards and turn to front. Now you are going to bend towards your left side. The left leg is gently bent. Try to keep the left leg, the bend of the left leg in 90 degrees. This is the final position of the asana, yogasana. In the side angle, you have been stretching, providing stretching for all the muscles on your side. You can have comfortable breathing. Stay in the posture for a comfortable time, then slowly release. And relax. You can perform the same yogasana on the other side also. You relax. Now we will shift on to the next asana. This is a famous asana called Virabhadrasana. Take one of your legs backwards. Then raise your arms to the shoulder level. Dip down. This posture helps to motivate the pelvic muscles, also the sphincters, also the muscles on your thighs. This helps for the proper stretching of your hamstrings, will also help for the ankle muscles. Then slowly release. This can be performed on the other side also. Now we will go to a small variation in the same Virabhadrasana, another type of variation. Again, raise your arms to the shoulder level and slowly dip down. You can look to the right side and focus yourself on the tip of your middle finger. Again, this variation helps for the stimulation in the lower part of the body. This is a variation in the Virabhadrasana. In the same way, there are so many variations. A person has to find the comfort range. A pregnant woman can easily perform this asana. Release and relax. These are some of the standing postures that a pregnant woman can perform. Now we are going to show you some of the sitting postures which are really helpful for a pregnant woman. If the pregnant woman is tired during her standing postures, she can opt herself for the sitting postures. Assume the sitting posture. We are now going to see some of the postures, some of the sitting postures which are helpful for a pregnant woman. A pregnant woman can comfortably do some standing postures. After performance of some standing postures, it is always good and advised to have some sitting postures. So one of the best postures and the best practice to have the pelvic muscles stimulated is the butterfly action. It is performed through Baddha Konasana. Keep your legs apart and slowly bring the sole of the feet together. Keep the feet together. The sole of the foot has to face each other. Then have a grip with your hand on your foot. And this is the posture of the Baddha Konasana. Now you can put a kriya into this. During kriya, during action, you go on moving your legs, the folded legs, in the beginning slowly, then gradually increase the speed of moving the legs so that the movement stimulates and motivates the flexibility in the pelvic muscles. You can do this type of rhythmic movement of the legs as long as you can do. Don't go beyond your normal range of comforts. Find comfort during your actions and find comfort during your stay. Keep the back straight and erect. Be relaxed, have a relaxed breathing. Then slowly release your hand grip. Then you can easily come to Sukhasana. If you find any difficulty in being Sukhasana, you can stretch out your legs and come to Dandasana also. Now we will go to the next practice, Upavishta Konasana. In this yogic posture, you are going to spread your legs to the sides. This is to bring an extension for the pelvic muscles and to prepare the hamstring muscles and to strengthen the muscles on your thighs and to bring a flexibility on your ankle. Try to reach your big toe with your fingers and try to have a proper grip on the big toe. In a regular practice, this is actually a forward bending. Being a pregnant woman, being in her last trimester, it is not advised to bend forward. Always avoid the touch of the abdomen to the ground. You can have a gentle bend forward. Then you can fold your legs and sit in Sukhasana or in Dandasana, whatever is comfortable for you. The same Upavishta Konasana can be performed to have a side bending, to have a lateral bending. Again, spread your legs. Find a comfort. Have an easy breathing. Now you can bend slowly to one side. Raise your arm and have a stretch of the shoulder. Then bend to the side. Don't push your torso forward. Take care of your abdomen. Don't put any extra weight on your abdomen. This is the final posture of the Parivritta Upavishta Konasana. You can stay in the posture as long as you are comfortable, then slowly release. You can have the same practice to the other side also. Then you can fold back your legs and sit in Sukhasana to relax. One of the hand rising postures is called the Parvatasana. In Sukhasana, you just raise your arms upwards, reach the shoulder level, then again raise your arms. Stretch your arms as much as you can. Keep the spine straight and erect. This helps for deep breaths. You can really sit for a long time in this posture. Then please slowly release. In the first trimester of the pregnancy, if the woman is comfortable, this can be performed in Padmasana, the lotus posture. If one finds any difficulty in performing Padmasana, this can be performed in Sukhasana also. If the abdomen is too projected, then this can be performed by stretching the legs in Dandasana also. Now we will go to the next practice. This is a practice by folding the legs, the famous asana called the Vajrasana. To fold the legs and to sit on almost on the heels. Try to keep the knees together and the foot together. The big toe of the foot are reaching. Try to keep the spine erect. You can have a comfortable mudra with your fingers, usually the chin mudra. Of course, this posture is a very famous posture for meditation. One can have the meditation in this posture. After the Vajrasana, you can slowly shift on to the next posture, that is called the Virasana. It is again a legs apart posture. Keep your knees together and spread your legs out. Find a comfort to sit down on the floor, on the ground. You are really sitting on the ground. Have a normal rhythmic breathing. Again, this posture is helpful for meditation. Even a pregnant woman in this posture can sit for a long time and have the meditation. This is called Virasana. From this posture, one can go to the next posture, a backward bending. That is called Ushtrasana. But a pregnant woman has to take care whether she can bend back or not. If she is really comfortable, can go for the practice of Ushtrasana, the camel posture. Rise on your knees. Then take the help of your right hand and reach the right heel. Then take the help of your left hand and reach the left heel. You can have a gentle backward bending. This helps for the comforts of the spine, extension of the chest, the clavicular muscles. It also stimulates the muscles on your abdomen. You can slowly release. You can feel a rich flow of blood towards your cheeks and towards your head. Then again be seated either in Virasana or in Vajrasana, whatever is comfortable for you. Relax for some time. Usually after a backward bending, you really need a forward bending, but during pregnancy, try to avoid any forward bending postures unless you are comfortable in that. Now, in the same sitting posture, we will see a lateral bending posture again. This is being on your one of the knees. This is called Parighasana. We are now going to see the Parighasana. Now you are supported on only your one leg. The other leg is stretched to this side. Take care to have the balance of the body. Then raise your arm and bend to the left side. Take care to have the balance of the body. This is a lateral bending, the side bending. have the support to the body by keeping the left hand on the left leg. This helps for the extension of the side muscles, the muscles on the right side. You can stay there in this posture for a comfortable time, then slowly release. You can have the same practice on the other side also, by folding the left leg and by stretching the right leg. Then be seated either in Vajrasana or in Virasana. Relax.